Hello, my name is Priscilla and I'm a nurse from OptHealth. I am here to show you how to use your injection supplies. So let's go over the supplies. You will be given a bag of syringes, 2 different sets of needles, the medication vial with your name and date of birth, and then a bag of alcohol swab. The reason why you have 2 different size needles is because you want to use the bigger gauge needle to pull back the medication from the vial. The medication vial sometimes has a solution that's thicker, so that's where the bigger size needle comes into play. And then the smaller gauge needle is the one that you will use to inject into your muscle. So let's start by opening up, grabbing a syringe. So I'm going to open up my syringe here. I'm going to pull up my bigger size gauge needle and attach the end of the syringe here. Okay, once you twist that on, you want to go to your vial, open up the box, and this is what you'll be reusing every week. So in order to clean it, we're going to take an alcohol swab, clean the top of your vial to make sure it is sterile. After that, we are going to pull back just enough medication that is prescribed. So every dose is different. Every patient has a different dose. So you want to make sure you pull back however many milliliters is prescribed of air. Take off the cap. And the easiest way to do this is to inject the amount of air that's prescribed into the vial. Flip it upside down, and when you let go, you can pull back however many milliliters is prescribed. So a lot of this is just pulling back and inserting it back into the tube, pulling back just enough and ensuring that there are no bubbles right there. So once you pulled back what you need, you want to pull this out. You definitely want to cap the needle again. We are going to untwist that needle. This will be discarded into the sharps container. And then you want to grab the smaller gauge needle, twist that on, and now your medication syringe is ready to inject. So at this point, you want to choose whatever IM site that you want to use. A lot of people use the gluteal muscle. You can also use your deltoid muscle or your thigh. So what you want to do now is go to your muscle site, grab a new alcohol swab, clean the skin, let it dry completely before you inject your medication. So once that's completely dry, the biggest thing you need to learn is you want to go at a 90-degree angle. So take the cap off, you want to go directly into the skin and insert the entire dose of the medication. When you're done, this will go into a sharps container. If you don't have a sharps container, you can use a water bottle, or water bottle or anything that has a lid. And then you want to include all of your sharps into that container. When you're done, make sure you wash your hands and you are all set.